Good morning and good afternoon, everybody, and a warm welcome to all of you to today's webinar. My name is Panos Fumsis. I work with the Senior Transformative Agenda Implementation Team based here in Geneva. Today's topic is going to focus into the Humanitarian Development Nexus, an issue that we have struggling with for a long time, trying to find a way really to ensure a better link, a better continuity between the humanitarian, the development, a better way to approach the needs of the humanitarian operations, where in most parts of the world are protracted. Clearly, this necessitates a different approach, a different way of trying to work together. And today's topic really looks into this new way of working, new way of bringing together the humanitarian development plans in the best possible way. But before introducing the topic and the issues, I would like to say a couple of words about the webinar itself. In line as with previous webinars, during the first half of the webinar, the first 30 minutes, I will be asking our two speakers a couple of questions to introduce the topic and to share their reflections from a practical, from an operational, from a field perspective. During the second half of the webinar, I'll be delighted to take your questions and ask them to pass them on to our speakers and hear their reflections on real issues, real situations you're facing in your operation wherever you are. To ask your question, I would like to point to the top right-hand side of the screen. There is a Q&A box, so you're very welcome to click at the box at any time from right immediately and send your questions in writing. The questions will come to me and I'll be asking them to our speakers. To the left of the Q&A, so on the top right-hand side, there is a chat box. I would really like to encourage you all to use it. This is a platform to enable to share among yourselves, to talk to each other, really to make sure that there is almost in parallel a chat box that takes place. I'm delighted to see a huge interest on today's webinar. We have colleagues from 80 countries, a large number of colleagues from Africa, Asia, Latin America, Middle East. Really, this shows a great interest on the topic and what our speakers will be presenting to us right away. The webinar will be recorded and will be available at our website in a couple of days. So it will be at deliver8better.org, and all of you who have participated, you will receive an email with a summary note of the main points that our speakers will be presenting and a link to the audio of the webinar itself on the website. I have asked our speakers really to share with us their practical field experience. The webinar really looks at the field application of the new way of working and hearing from colleagues in the field. I also want to point out that there is a poll that has opened. You will see it on the top right-hand side of your screen, and it's opening right away. And in this poll, we're really just trying to get a sense of who is online and get your feeling on your experience on the topic itself. To answer to our questions, we have two distinguished speakers that I'd like to introduce right away. I'm delighted to introduce John Ging. John is the OCHA Director of Operations. And I also like to introduce Marta Ruedas, who is the Resident and Humanitarian Coordinator joining us from Sudan. A warm welcome to both of you. I also want to point out that in case any of our colleagues listening have an audio problem, I'd like to encourage you to link through the stream link, which is the line 3 on the screen in front of you, which would really, you'll be able to get a better audio through a YouTube download of this webinar in case you're reaching us from a remote field location and the audio is not very good. So, John, I'd like to go first to you, and great to have you with us. And I'd like to ask you, this new way of working, linking the humanitarian development nexus, this is an issue we have been dealing with for quite some time, almost the last 25, 30 years. We have come with different names, different initiatives, different approaches, and to be honest, really, it hasn't worked in the past. So the question many colleagues are asking is, how is it going to be any different this time from any previous efforts? What is it that we're trying to do in a different way? And I also want to echo a question that we received in advance of this webinar for many colleagues in the field who want to know practically what do we do? How do we go about really to activate a process, a system, a mechanism that would enable this short-term, long-term humanitarian development approach in our own operation? Where do we go to get this help? So, John, over to you.
Thank you very much, Panos, and thank you for hosting this very important discussion, and welcome to Martha and all of the colleagues who are online for this discussion. I think you asked the two most important questions. The first one being, having had a number of efforts over the last 2 or more decades, how are we going to succeed in our ambition this time round? I think the answer to that is by doing things differently. If we repeat the way we have been working, then we won't get the change. But we shouldn't also discount or disregard totally the efforts of the last 25+ years. Whether it is the link between relief and development of the 1980s, whether it's the continuum debate of the 1990s, whether it was the early cluster as part of humanitarian reform in 2005, or the resilience agenda of the last 5 years, which came in 2011. I mean, these were not failures, but they were not as successful as we would have hoped they would be. So I think what we have to first and foremost identify is firstly the building on the things that have been working. So we have been doing over the last number of years a lot more on resilience and making sure that humanitarian action itself is sensitized to the responsibility around resilience. For example, use a simple example that when we are facing a crisis and we have a food insecure situation and we're responding necessarily with food assistance, at that moment we're also asking the question, what's next? And therefore, if it's appropriate in the first wave of response to put seeds and tools on those trucks with the food to build resilience, to help people to recover, then we must do that from the outset, not as an afterthought or when the first round or the first wave is over. It's about, getting everything going from the start in terms of not just helping people to survive, but helping them to recover from the crisis that they're facing. And that's why the mantra is that saving livelihoods is also part of our life-saving endeavor. Now, what of course the new way of working that we're now looking at is taking that to the next level. We have, of course, the laudable ambition of the Sustainable Development Goals, which talks about leaving nobody behind by 2030. And we've had a World Humanitarian Summit last year where there was huge commitment made across the board to reducing need and helping people with recovery from their crisis situation. And this is to be done in a way that, again, enhances our effectiveness in the nexus between humanitarian and development. I think one of the biggest sources of optimism in terms of this new way of working and doing things differently was the engagement of the World Bank at the summit itself, where the president of the World Bank was fully present and really made tremendous commitments around what the World Bank and its very significant resources will do differently in these fragile and failing states, in conflict settings, about being more present, being present throughout, not waiting for political solutions, but actually getting in there with the humanitarians, working alongside humanitarians on issues like shoring up public services, health services, education, and so on and so forth, and being much more flexible and adaptable in doing so, because there has to be a much higher tolerance of risk. We, in the humanitarian community, of course, we embrace risk as a daily reality in crisis settings, to the point that humanitarian colleagues also tragically lose their lives. Such are the risks to deliver the humanitarian response. There hasn't been historically or traditionally the same degree of willingness on the part of development actors like the World Bank to get involved in crisis settings where there are very high risks, including financially high risks, where their investments may be lost very quickly and may not actually work. So now they have to embrace a completely different risk matrix in terms of the value equation, where they realize that if they don't take those risks, then both the financial cost and the human cost will be much higher down the line. So better to intervene earlier and embrace those risks and carry those risks so that we will actually achieve a higher human impact, positive, and also reduce the financial cost that would otherwise escalate over time of delay and so forth. So I think in summary, on the first part of your question is that let's not be cynical on this. Let us look back and learn the lessons of past endeavors, and there have been many of them. Let us also recognize that many of those endeavors have contributed positively, but they have not achieved our ambition. That's why we have to redouble our effort, and we have to do things differently. The basis for our confidence that we are going to succeed this time round is that many actors, like the World Bank, but not just the World Bank, the largest number of commitments made in the World Humanitarian Summit were on this particular issue. So we have a lot of people very committed to doing things differently on this issue across the board, not just on humanitarian side, because I think that's a very important message. It must be our development partners doing things differently on their side, in tandem with ourselves, so that we can actually help people not just to survive a crisis, but to quickly recover from a crisis, and also prevent the crisis from descending into what it could otherwise descend into if we don't have the earlier intervention of the development actors to help people on the side of resilience to cope with the crisis. And that's most visible in areas like livelihoods, but also in health services, also on education and so forth. Because again, very, very important, humanitarians on their own cannot deal with these issues. These are much bigger than the humanitarians, and yet the humanitarians too often get caught up in having to substitute for failing public services and so forth. And so I do see a lot of commitment to doing things differently on this issue, to building on the lessons of the past, and a lot of energy and commitment around it. Now, the second part of your question was on practically speaking, from a field perspective, what are we talking about? Well, actually, it's, again, in the simplicity, I think will be the success. The first thing is that we have to get on the same page in the whole international community on joint analysis of the situation. What is the situation that the people are facing? We humanitarians must have the same narrative in terms of not just the actual situation, but the analysis, the drivers of that situation. Because if we're going to address vulnerability, if we're going to address risks, then we must all come together, pool our information, and be on that same starting point. Because if we're going into this together, then we have to get onto the starting point together, and then take it forward. So we get our joint analysis absolutely at one. So we're not contradicting each other. We're not having a different set of understandings and so forth. And again, here I think the humanitarian community can contribute enormously to our development partners. But we've got a presence, we've got insights, we've got knowledge, we've got experience, we've got context, and so on and so forth. So rather than our development partners setting up their own separate way of analyzing and data analysis and needs assessments and so on and so forth, let's work together. That will be much more efficient and much more effective. So that's the first thing that we need to do differently at the field level. The second thing is that we need that our planning is joined up. That you know, humanitarian organizations are not operating in a vacuum of the wider international effort. This will also then mean that equally our development partners are not operating in their own separate silo. That we're actually seeing ourselves as important, distinct instruments of the same international community. So our obligation is that we are actually joined up. And for humanitarians, there's huge advantages in this, where our exit from the provision of, for example, health services very much depends on the entry of the local services and the support that those local services receive in their development and so forth. That is very much conditional on the humanitarian side ability to get out of direct provision of health services. So we need our plans to be joined up in that regard. So if you have a joined up planning, then the donors can see also the benefits of putting the money in to both work streams simultaneously, because you're not duplicating, you're not overlapping, you're actually in synergy and so forth. The difference of work for humanitarians will involve that we'll have to move more quickly to multi-year planning, and that multi-year planning is then linked to the multi-year plans on the development side. Again, very, very important that we're not doing it in a vacuum, but we're actually doing it in a linked way. The other two areas where, practically speaking, and this will be my final point, where practically speaking field colleagues will be doing a lot more together is in the areas of coordination and financing. So we know that we have to operate distinctly. Humanitarian operations will not be just blended and melded and unified into one endeavor, because the modus operandi for humanitarian operations is very different than development. The modus operandi for humanitarian operations is based on principles, it's based on consultation with member states, but it's also based on the humanitarian imperative. And that is very different from development action, which is based on partnership, it's based on consent, it's based on government leadership, it's based on a supportive posture, and so on and so forth. So we have two different instruments here for effectiveness purposes, because in many of the areas where humanitarians work, the government is actually part of the problem, and they're a party to the conflict. So we won't be entering a partnership with government where government decides who gets the aid, because we have a General Assembly resolution 25 years old that basically says, no, you will consult with the government, but you will operate in accordance with humanitarian principles, the humanitarian imperative, and you have an obligation to reach all people, irrespective of the politics and so forth. So that's why we have to also understand that the two instruments will be complementary, but the complementarity must be improved. So therefore, we have to have more joint sessions between the humanitarians and the development in the coordination, so that we optimize the impact and the effectiveness of what we are doing, and that we're all fully aware and able to answer the question through the eyes of the affected population. They really, in the end, they don't care about humanitarian development or anybody else. They care about the assistance and the support that they are receiving, and whether it's working for them, whether it's helping them not just to survive, but also to recover from the crisis that they're in. So their expectation when they look at us as international instruments of an international community is, get your act together. and make sure that you're optimal in your effectiveness and your efficiency. So we're going to have to work out how we can actually meet that demand by the affected populations. And similarly on the financing side, we have to also look at how to mobilize earlier, much larger sums of money to help with the recovery, the resilience building, the livelihood support, education, and so on and so forth. And on this one, there has been a lot of pledges over the years, particularly on the development side, commitments around the levels of overseas development aid, the funding of the Sustainable Development Goals at 0.7% of GNI, and so on and so forth. But this has not happened. This has not translated into action. There are only 5 countries in the world that give 0.7% of GNI towards ODA. And without the financing, well, we're not going to actually achieve our ambition. So therefore, we have to really work hard on how to get the financing mobilized in a new way. And we have to do that together, not in a competitive way between humanitarian and development, but again, in a much more unified way, and then working to the comparative advantages from the perspective of, again, the affected populations, and that we can explain to the affected populations that this is the best use of international funding for their benefit. So I'll stop there, Panos, but looking forward, of course, to the follow-up questions and so on. Back to you.
Thank you. Thanks, John. Quite a lot of innovations, a lot of new steps, new ideas, which are very welcome. The engagement of the World Bank, the higher risk-taking steps taken, as you said, really trying to reduce the cost by intervening earlier on, but also the multi-year planning. I think your clarification also that we are not blending into one. I think that's very important, but rather looking at the linkages, how to bring it all together, the complementarity, the joining it in a way to optimize impact. I think that's all very important. The role of the donors, and I welcome, we have about 12 capitals listening to the webinar. Very, very, very good to have the totality of the community together. John, you also spoke about the principal approach, which is, of course, it's essential in what guides the humanitarian action. And many humanitarian colleagues are asking, but you know, how do we do this humanitarian development nexus, and how do we take into consideration the political context, the peace and stability, in particular in a conflict situation? How do we go about that? Can this new way of working extend into non-government control areas? How can we go about it? I also want to apologize to all colleagues. We're having actually a technical problem with the visual PowerPoint presentation that we're really trying to sort out. I hope it will be sorted out instantly, but in the meantime, I think we can continue this conversation. So, John, what are your thoughts on in conflict situation in non-government control areas, and how can one go about ensuring that we really leave no one behind, as you said? Over to you.
Well, that's precisely it, Panos, that again, we don't see this as the responsibility of one instrument or another exclusively anymore in terms of leaving nobody behind, irrespective of their context. Obviously, it will be easier in some contexts to deliver the sort of resilience, livelihood support, recovery initiatives, and so forth. But again, the commitment that we have made at the global level is that we are going to engage together everywhere. Nobody left behind means nobody anywhere. There's no caveats on this. We recognize that in an active conflict zone, quite obviously, that is much more challenging than it is where you have other factors at play, and that then means, of course, that we are acknowledging that we have to find a different entry point. So traditionally, development partners would be working with the local authorities, with the with the state-level governments and so forth. So if all of that has broken down, then you have to actually go to another level to engage. And this is what really encourages me about this new initiative, particularly when I hear the World Bank engaging with huge amounts of money for places like Yemen in IDA funding, for example. These are the concessionary loans, and putting in hundreds of millions of dollars into a country that doesn't have a government on the ground controlling very much territory at all, and not even the capital city of the country, and yet recognizing that we have to shore up the vital public services. Civil servants have to be paid, doctors, nurses, teachers, and so forth, and we cannot fail to intervene now, waiting for a resolution that may be years away. So I do feel that that is the first step in this, in the sense that there is a recognition and a willingness to embrace the challenges around that, and as I said, to accept losses, financial losses in that engagement, because you're caught up in very difficult settings, violent settings in many instances, dangerous settings, and you have to be ready to take those losses that go with that. The second thing then is that looking at partners who are present. So you will have a lot more organizations that will be doing both. We already have a lot of international NGOs and UN agencies that are dual purpose. They do development and humanitarian. And of course, those instruments on the ground will be utilized for that purpose even more so as we go forward. The third thing that I would like to say is that again, it is important to understand that for effectiveness, you must have a distinction also on the humanitarian side in many settings and for many purposes. So when we talk about, you know, the humanitarian imperative, humanitarian principles, it's not because we have any ideology or we think that we are, you know, of higher order in terms of our values or principles than other parts of the international community. It's not that. It's actually for effectiveness. So to be effective, to be able to gain access in many of these conflict settings, you must, both in fact and perception, be seen to be independent, to be neutral, to be driven by humanitarian need, irrespective of political affiliation, and so on and so forth. So the principles by which we operate are there for effectiveness, for the purpose of effectiveness. And that's why it's very important that we protect the integrity of the humanitarian instrument in such contexts, and realize that, you know, the humanitarian instrument is a very important instrument of the international community, which has a distinct value in certain contexts that must be respected. Otherwise, we lose the effectiveness of that instrument. But the effectiveness of the instrument is not lost in enhancing the linkages, in optimizing the prioritization, whether it's in the international humanitarian interventions or the development interventions, and so on and so forth. So again, I come back to the point that in any and all of these contexts, we will find that working better together in strengthening the synergies, strengthening the linkages, joint analysis, joined up program planning, all of these will be for the better result for the people who are affected. So again, I think we have to keep that foremost in our minds. And the last point is that on the political side, on the peace and security side, we all know that in these conflict settings, humanitarian is not the solution. So therefore, we absolutely have to be linked also with the resolution of the conflict. Now, we're not involved in conflict resolution, but we have to also be part of a wider international effort, in the first instance, understanding what is required, communicating, advocating, and so forth. So the humanitarian voice calling for political solutions, sharing the analysis of what's driving the conflict and what the problem is and the consequences. It's an incredibly important contribution in the wider international effort of conflict resolution and conflict prevention, which is, of course, the key. The number one issue for people is to actually end conflict, to have protection from conflict, to have security for themselves and their families. So we have a huge responsibility on the humanitarian side to advocate very strongly for that and to promote an understanding of what interventions will work on the peace and security side, again, based on our knowledge, our experience, our understanding of the situation. And as I said, being cautious about, again, not getting drawn into those activities ourselves, because otherwise you could lose your impartiality, your independence, the perception of your neutrality, and so on and so forth. And again, that's something that for the purpose of effectiveness, we have also got to protect. Back to you, Pam.
Thank you. Thanks, John, for highlighting really the principles, the practical side, and of course, to the need to take into consideration the broader context under which we operate. I'm really sorry we're still having trouble with the visual presentation. In the meantime, I want to say a particular welcome to really a number of resident coordinators, humanitarian coordinators who are on this call live. I can see several of them from around the world. At this point, I'd like to actually bring in this conversation Marta Ruedas, the resident humanitarian coordinator, who is joining us live from Khartoum, from Sudan. Marta, excellent to have you with us. You have really taken ahead this new way of working and taken a number of steps in the Sudan context to bring a difference, to really make it happen, to make it more effective, more efficient, as John was mentioning. So it would be great if we can hear from you. What steps actually did you take in order to bring closer this humanitarian development approach in terms of actors, in terms of coordination, in terms of donors, in terms of programming, and most importantly, in terms of impact for the very people we're there to help? Marta, over to you.
Thank you very much, Panos. It's good to participate in this webinar and great to hear John's input just now. I think there are a number of steps that we have taken. The most important one, I would say, is really to start to shift the approach of people, because you know, there's an important law of motion. You know, a body in motion tends to stay in motion. Inertia. People tend to become very comfortable with the way that the things are being done, and they don't necessarily shift the way that they engage. So just the mind shift is important, and the only way to do that is really to get people across the board from the humanitarian and development work streams to come together to discuss issues jointly. And I think it's important what John mentioned. It's not that there are separate necessarily humanitarian and development actors. Many people, you know, many agencies are doing humanitarian work and development work. It's really about the work streams, the objectives of what you're doing. Some of it is a development work stream, some of it is a humanitarian work stream. But it's the same agencies that are engaged, the same NGOs that are engaged on both sides of the issue. So it's not that difficult to bring them together. Having said that, we did need to take a few concrete steps to get people to think about things a little bit differently. We created within my own office a position of Humanitarian Development Nexus Advisor to be able to engage specifically on that with the range of UN and UN agencies and NGOs and donors that are sitting around the table here in Khartoum. We brought together the development coordination and the humanitarian coordination around the table on a regular basis to discuss specific issues. And of course, after a mission by John, actually, who committed to a multi-year humanitarian response plan here in Khartoum. We were able to get some traction on that, and we've developed a multi-year humanitarian strategy simultaneously with an UNDAF. And the multi-year nature of the humanitarian strategy has enabled us also to have a little bit of a longer horizon to gain some traction that can make it work better, let's say, with the UNDAF. One of the issues that we have here is chronic malnutrition. It is at a level that cannot really be addressed entirely with humanitarian response, and yet at the moment it is being addressed solely through a humanitarian mechanism. But we need to address it structurally. Now, as John very rightly said, you cannot disengage from the humanitarian and deal with it only through development. You have to do both simultaneously, and that's one of the things that we are trying to do through these two strategies being linked more closely together. We've taken a number of other important steps. There are specific issues. I've just mentioned one, malnutrition, but of course we have a huge population of displaced here in Sudan, so the durable solutions agenda is one that is particularly well placed to bring together both the humanitarian and the development work streams. So we are working very actively on that. We've brought together the joint IDP profiling service, the cluster, the global cluster on early recovery, but also the World Bank, which again John has mentioned. We here in Sudan are benefiting actually from the UN World Bank Partnership Trust Fund for Humanitarian Development Peace Initiative, and that is funding specifically joined up analysis on IDP profiling that will feed into the durable solutions agenda. And of course, we are also trying to address the systems and mechanisms that can make our work more efficient and more effective in focusing on this new way of working. We are also working very closely with the donor community on more flexible financing, which is a very difficult engagement indeed. But we have a number of different engagements with donors to bring that part of the grand bargain to the table as well. So we've just recently also benefited from a financing mission that was composed of the OECD, the Multi-Partner Trust Fund Office, and OCHA, to try to put together a financing infrastructure for the new way of working that we are putting together at the moment. Over to you.
It's blocked. Can you hear me?
Yes?
It's blocked.
I can hear you.
Martha, thank you. We were blocked in the system for a minute. Really refreshing to hear the steps, the approach you took. Here you're talking about durable solutions, which is really the ultimate objective for all of us, working on a principled way, working together. Your example of chronic malnutrition, addressing it really on both platforms and not only one or the other is really vital. Having gone through the experience and having tried now for the last year in Sudan, what it would be great if you can tell us what are your lessons learned so far on the new way of working? What would you say that has worked well, or what you have done differently? Over to you.
Well, firstly, I would say one of the most important lessons is that you do have to be willing to take a risk. And you know, I mentioned at the beginning of this intervention that people feel very comfortable with the way that they have been dealing with things. And so equally, the converse is true. They feel very uncomfortable if you go into a new way of doing things. And I think we have to really take that risk and be a little bit daring, challenge ourselves, and that is a very important step. It is something that I think, you know, if you are sitting around the humanitarian or the UN country team table and you are all convinced of it, it's a shared risk, there is a little bit of an easier step than if you're all alone to take it. But, you know, it does require a little bit of courage. Equally, I do agree with John. You know, you don't want to throw the baby out with the bathwater. You don't want to necessarily force any dramatic or drastic changes. You do want to take things gradually and be sure that you are taking the right steps as you do. You know, you want to mitigate the risk. But also, you know, you do have to take that risk because other people are already forging ahead, are already pulling together the two work streams, the two humanitarian and development work streams. Much of where this new way of working is operating is protracted crises, and in protracted crises, you have humanitarian, development, peace, war, and everything in between, all happening simultaneously, and you have to address it in a coherent fashion. And so, you know, people are doing this, and if we aren't able to do it ourselves, we will be left behind. So we do need to be ambitious. We do need to work on this together. I should say, in terms of working on this together, I forgot to mention one other thing that in my previous intervention, that we also benefited from a joined-up mission to try to make recommendations on precisely those areas that John was mentioning about planning, about analysis, about coordination mechanisms. And this was a mission composed from, or organized rather, between the IASC and the UNDG, as well as the Global Cluster Coordination Mechanism. So it was really a very, very robust mission, and we're looking forward to getting the recommendations from that. But or rather, coming out of that mission and coming out of our own internal discussion as well, one of the clear ways that we have to pull towards is towards collective outcomes. That is to say, we can have separate instruments, the humanitarian response strategy and the UNDAF, but we are pulling towards one single agenda. Obviously, we have the SDGs that are the overall agenda, but you know, on malnutrition, which I have mentioned, there are humanitarian aspects of this. There are development aspects of this, but the overall collective outcome is to reduce malnutrition. So we want to have collective outcomes that cover the entire range. I think it is important to make the mechanisms and the systems that we have suit the purposes that are changing along with this new way of working, and that is a work in progress here, but is absolutely necessary to happen. And the financing is a great unfinished agenda, one objective that really needs to absolutely be brought into line, and we have to work with the donors towards that. And I would leave it there for the moment. Back to you.
Thanks, Marta. We're very much looking forward, actually, to taking these lessons learned from the Sudan operation. I'm sure many other colleagues are looking into their own country operation, where they're working, and see how to be able to advance it. I'm now going to be taking questions as they come in, and thank you, so many of you have sent questions. But before taking the first question, I want to reassure you all that the PowerPoint, which unfortunately we've had email after this presentation. The system is back on again, but there was a part that was missed together, of course, with the summary note that will come out. John, I'd like to take to you the first question. And one of our colleagues, actually from Oxfam, is making the link and asking the question between the role of local actors and leadership by local actors and the humanitarian development nexus. The question is, one of the commitments that came out at WHM is indeed to enhance the leadership and the role of local actors. So what advances have been made in this area, and if you could elaborate a little bit, how does it fit with the nexus? John, over to you.
Okay, thank you very much, Panos, and to our colleague from Oxfam. I think again it's the right question to ask, because you know most of the action takes place through local actors, whether formal or informal, and this was why at the World Humanitarian Summit, one of the big agendas that was promoted was, how do we as international organizations really strengthen the localization, the local actors across the spectrum, not just on humanitarian, but also on the other interventions. Because in the end, in every context and every setting, it is local solutions that will be most effective. For us, historically, in international humanitarian action, there has been a particular challenge in conflict settings for local actors, including our local staff. And I think it's also very important to recognize that most humanitarian workers for international organizations are actually locals themselves. But the local organizations issue, if it were easy, it would long ago have been resolved and addressed successfully, because it's easy to see, number one, that local organizations have much more potential for effectiveness given their knowledge on the issues. And number two, they're much less expensive than international organizations, international instruments. But then, why then is it that it's such a challenge? And it is about the whole question of the first and foremost the issue of politics, both in fact and in perception. Many local organizations are not perceived, or in fact are not neutral, and that's of the politics or of the sides in a conflict setting. That does not mean that all. It doesn't at all. It just means that many. So it presents us with a challenge. There's also a challenge around capacity, and you know, to get international funding, there are very high bureaucratic demands placed on operational entities, be they NGOs, UN, or others, in terms of what's called accountability. And this can many times be an obstacle to very effective organizations being able to access that funding, because simply they don't have the bureaucratic infrastructure to meet the so-called accountability requirements of accounting for the monies themselves and so forth. So all of that is to say that we have a lot of challenges to achieve our ambition around the localization agenda, but it's very much part of the agenda on humanitarian development nexus, because the most effective in that nexus will be local actors. The most cost effective in that nexus will be local actors. So the more that we collectively, and I very much agree with Martha, that our new way of thinking and our new way of working is, in the first instance, not to look at things through our own lens, but rather to look at them through the lens of the people who are depending on international action, and think collectively about how we can best meet those needs. And when we do that, it is actually most effective, cost effective, and operationally effective if we can engage local actors, local organizations, formal, informal, to be the instruments of actually action. And that's why we will be pushing very hard, all of us, in terms of helping them to overcome the current obstacles to their engagement with international funding, because that's what it's ultimately about, that we have to get the money to them in the most speedy and efficient way, and help them to be able to access that for the benefit of the people, but also for the benefit of the internationally funded endeavor, because of its heightened effectiveness and efficiency if it goes through local actors. Back to you.
Thank you. Thanks, John. We have about 10 minutes left to the webinar, and I have a number of questions in front of me. So, Martha, one of our callers sent a question in saying, Martha has been talking in Sudan about the new way of working. Can you elaborate, what is the role of early recovery in the current approach? What is really the early recovery cluster's role in within the new way of working? Over to you.
Well, I think the thing to keep in mind is that the new way of working is not restricted to any one cluster. The new way of working is really about the overall approach that we take collectively as an international community, not even just as the United Nations. So, you know, we have to change the approach. One part of the reason why early recovery is no longer really at the heart of this new way of working necessarily is that it became, in a way, restricted to one cluster. So, so that is something to bear in mind. Having said that, very much in the same way that that John mentioned, these are concepts and approaches that are by no means out of date. You know, you do have to think about what the impact will be of the way that you are engaging in humanitarian response on the more sustainable and longer term issues, and that is what early recovery was all about. We do still have to build in resilience in everything that we're talking about, so none of the concepts that we have engaged on in the past are necessarily bad, but we are going beyond that. We're building on them to something that is much more comprehensive. So that's how I would answer the question. Over to you.
Thanks, thanks, Martha. John, I'll come with a question to you. One of our callers, listeners, one of our colleagues has sent a message saying, as John said, one of the problems we have experienced is really the slowness of the development funding and getting our colleagues from the development world to come to indeed this risk area. But really the funding, the financing is a crucial missing piece. So the colleague is suggesting and is asking, within this new way of working, is it at all being considered to have an equivalent of a SURF fund, but really that includes the humanitarian and development funding that is dispersed in a fast way to be able to address this protracted need, like Martha talked about malnutrition or other needs that indeed need a parallel simultaneous approach on both ends? How can we make the money go faster? John, over to you.
Thank you, Panos, and thanks for that question. The answer is yes. We have to find the different instruments that will allow the money to flow faster. I mentioned the World Bank taking a new initiative around their financing instruments in terms of the IDA funding, and they have released hundreds of millions of dollars now in this new approach with a very different modus operandi and much faster release, including in new approaches vis-a-vis how that money is dispersed and so forth. I think that the SURF has been a great instrument for the rapid release of urgently needed funding for life-saving on the humanitarian side. I think it's important for participants to also know that the SURF has evolved over the years, where in line with the early recovery cluster, in line with being part of humanitarian action, in line with the resilience agenda of 2011, livelihoods are also part of the life-saving component of humanitarian action. And again, SURF funding has covered much more than, for example, just therapeutic feeding for children or medicines and so on and so forth. You'll also see windows in the country-based pool funds also being as forward-leaning as they can be to make sure that, again, from a humanitarian perspective, we are contributing as much as we possibly can to the resilience of people and their early recovery, while of course facing the dilemma that we don't have sufficient funding for the basic life-saving of the medicines and the food and the other elements to it, which then takes us to the fact that this does need fresh thinking, a new approach, as Martha said, on the financing, the overall financing. And remember, in overseas development aid, that's where humanitarian comes in. It's about 15% of the totality of overseas development aid from the principal donors. So 85% of what they invest is on the development side. But the problem is that the approach has not been fast enough. It also hasn't been forward-thinking enough. I mean, again, we have to look at this from the perspective of not a couple of years, but a decade plus in many instances, and that the upfront investment required may seem a lot, but when looked at out over a 10-year time frame or a 15-year time frame, actually it's hugely cost efficient if you front load and speed up the disbursement. So I know that there will be a lot of discussion going forward on what are the optimal instruments. It may not be that we need new instruments entirely, but we need to optimize existing instruments. There's the multi-donor trust fund instrument and many others on the development side, which, you know, again, the question will be, can they be now reformed and better funded, frankly speaking, in the first instance going forward. But for sure, if we're going to work together on the front line, then the funding must flow quickly in an emergency mentality of speed and flexibility that is required in these contexts. And that is most definitely the big question mark that will, ultimately determine success and failure in this issue. Money is the key. Thank you.
Thanks, John. I'm trying to squeeze one more question to each very quickly. Martha, one of our callers asked, to what extent, when you try this humanitarian development, new way of working approach in the Sudan context, you incorporated issues related to preparedness, early warning, early action. Over to you.
Well, I think that would be part of the joint analysis that that John was referring to. We have, as part of, I think, both work streams, both development and the humanitarian work streams, we have a number of activities that are addressed to trying to identify potential gaps further down the line. Whether they work well or ill is a different issue, but we had, I think, a reasonably good assessment of the issues that were coming down the line with regard to the to El Niño, and were able to engage in both, again, both on the humanitarian and on the development side of the work streams on that. And I think it's maybe the short answer would be not necessarily systematically, but I think early warning is incorporated as part of the joined up analysis. Over to you.
Thanks, Marta. Indeed, coming to the joined up analysis. John, a last question is really more of a comment than a question or a word of caution, a spicy one, I would say. One of our colleagues in the field who is listening sent a message saying, we very much welcome, of course, the new way of working, trying to find these practical ways of bringing humanitarian development together. At the same time, clearly on the humanitarian side, we need to have all the hands on the deck. While we hear about structures, different ways, we really have to make sure that we're not feeding the beast with more processes, and we really keep it lean, light, and in a way that moves everybody forward to the right direction. John, any reflections on that?
Yes, I think that is absolutely essential. You know, there's a danger here that we get sucked into an intellectual endeavor and create new processes, new work plans, and all sorts of new bureaucracy around something that essentially is much simpler if looked at through the eyes of the people who depend on international aid and support. And that, I think, is at the heart of the success of this, is that instead of looking at it through our instruments and the lens of our current functioning, that we really and truly put the affected population at the center and look back from their perspective at all of us. And if we don't make sense to them, then we're not making sense. Equally, we have to look from their perspective at the instruments and say, is this really the best that you guys can do? For me, a person who depends on international support in a given context, and if we can, then we're on the right track through the eyes. And that again is where, you know, one of the issues that we have collectively not really stepped up on, which is accountability to the people that we serve, and they're influencing much more how we do our work, what we do, what we prioritize, and so on and so forth. So part of this new way of working will absolutely be about putting them at the center. And I want to reassure people listening in that we are, you know, very much looking at this from the point of view of not wanting to create more complexity or bureaucracy around how international work is conducted. In fact, it should be simplification, streamlining, speeding up the effectiveness of our collective endeavor. And I just want to echo what Mark said about, you know, us in whatever part of the international community we are working through, having a single agenda, which is about doing the best for the people who depend on us. Back to you.
Thank you, John. It's really reassuring, your last message, and indeed keeping it simple and not adding more processes, but yet bringing the results for the very people we're trying to help. Colleagues, I'm afraid this brings an end to this 1-hour webinar. I would really like to warmly thank our two speakers, Marta Ruedas, Resident Humanitarian Coordinator, who joined us live from Khartoum in Sudan, and John Ging, OCHA Directors of Operation. Really big thank you to both of you for sharing for reflections. I also want to thank all the colleagues who have joined us from really different parts of the world for this conversation. I want to reconfirm that we will be sending to all of you a link with a recording of this webinar, together with the part 1 of the webinar that was broadcasted 2 weeks ago, along with a summary of the key messages or points that came out. Really a big thank you to all of you, and wish you a good rest of the day, and a goodbye from us here in Geneva.